Hi, my name is Terry Ginsberg, and I'm here to talk to you today about healthcare reform. The figure most frequently quoted is that there are 47 million people without insurance in the country today. Of the 47 million people, approximately 50% are made up of undocumented immigrants and young people who are just choosing not to add the expense of healthcare insurance to their lives right now. So, with that, we're really looking at, let's say, 25 million people who are actively seeking health insurance and cannot afford it. Now, there's 300 million people in the country, and even if you took the full 47 million, called it 50 million, you're looking at 1/6 of the population. That's less than 17% of the population. So that means 83% of the population has health insurance. In a recent poll, 83% of the population that has insurance, 85% rate their insurance coverage as satisfactory or better. You're looking at in excess of 70% of the population having health insurance and perfectly happy with it. For 30% of the population, we are going to go ahead and undo the entire system. I'm not sure I think that's a great idea. To be sure, there are some reforms that would make a difference. There's a lot of waste in the system between billing, malpractice insurance, unnecessary tests for preventative medicine, people delaying going to primary care at the first sign of illness and waiting to end up in the emergency room when you have a much more severe condition. Things like this add millions and millions and billions of dollars cost to the healthcare system. What I would do is, first of all, mandate that people have a primary care physician to handle all their initial illnesses, as well as annual checkups to keep an eye on chronic things as they pop up. More importantly, though, what's absent from healthcare is the true market forces of consumer and provider. Right now we have insurance companies getting in between the relationship, so consequently there's very little price control, there's very little incentive for consumers to shop for the products that they use in healthcare. Think of another relationship in your life like that. If you have the opportunity to not have to worry about the price, when you go to buy a car, what car are you buying? The bottom of the line stripped down model? Or are you going for the full-fledged luxury edition? It's kind of a no-brainer, and that's where a lot of waste comes from as well. What I would do is means test everybody's annual deductible to the previous year's income. What that means is, for people of an average household income of, let's just use the figure, $75,000 a year for a family of 4, would say have the first $3,000 of their health care expenditures for anything from prescription drugs to eyeglasses to dental work to open heart surgery come out of pocket, payable at the time services are rendered. That means that eventually, and maybe not right away, people will start shopping. Why would they go to the doctor who's no better than the one next door and charges $15 a visit more? The second issue of that is the cost to the physicians themselves. Currently, they have to employ 2.3 clerical staff to collect from the insurance companies and from government payers for services they've already rendered. If bills were payable at the time services were rendered, you wouldn't need those people, and that would reduce physicians' costs. Additionally, a physician getting paid $35 today for a $35 bill today will see the full value of that $35 as opposed to waiting 6 weeks or longer to get paid by the insurance company, where that $35 may now be worth $34. Both of these measures will help physicians lower their cost of services. This is just the beginning, but I think it's an effective start, and I think it's one we could do right away. I hope you'll join me on this, and I look forward to further discussions. Thanks for listening. Bye-bye.